All right, thank you, Rachel. It is time for our Health Watch, and as always, we are joined by our friend of the show, Dr. Syed Hussain of Trinity Health of New England. Good morning.
Morning.
So excited to chat about these topics this morning. The first one is holiday related. So some doctors are warning of what's called holiday heart syndrome. So can you break down what that is and how people can prevent it?
Yeah, let's talk about this. So by definition, holiday heart syndrome encompasses the most common abnormal heart rhythm, which is atrial fibrillation, irregular heartbeat. We should probably also include heart attacks because we see an uptick during the holiday season. So clubbed together, the incidence of heart-related issues goes up. Why? Because of a number of factors. So there's overeating, there's binge drinking, there's stress related to finances, stress related to obligations, stress related to family gatherings, all of these things coming together, and not to mention physical inactivity too. All of those coming together, if you have some risk factors, that's almost the perfect, time bomb, if you will, in terms of having some sort of heart-related event. So please, as we all, get ready for the holiday season, keep it in mind. It's probably not the best idea to get that extra serving. Get some physical exercise, even if you, have to juggle things around. It's important for health comes first, and so keeping those common things in mind, and not too many drinks, obviously, will prevent some of these side effects.
Okay, and you want to make sure you're getting some quality rest too.
That's right. Great point.
Yeah, I'm going to put Mama Privet on blast right now when, we're getting closer to the holidays, and she tends to stay up trying to do everything and, prepare last minute dishes, make sure the presents are wrapped up and the house looks good.
Delegate.
Yeah.
And get some rest.
Delegate and get some rest. I like that one. All right, up next, we've been talking a lot about respiratory illnesses and viruses going around, but there is a new super flu strain. It's being called a super flu strain, and it's spreading pretty fast. So what do people need to be on the lookout for?
Yeah, this is a type of influenza A. It's the H3N2 subclade K. I know that's a mouthful, but this is the virus, this is the variant of the flu that's been going around causing higher cases than usual, quicker and faster in other countries, Europe, Japan. We saw it a few months ago in Australia too. Now it's here. New York City, for instance, is seeing one of its highest flu cases so far compared to last year, which was characterized by the CDC as a very severe flu season. New York City, just to look at data, had 10,000 confirmed cases of flu by middle of December last year. This year, they crossed that threshold end of November.
Wow.
So it's quicker. It's more cases that we're seeing. Same thing in Connecticut. That's next. So folks need to keep all of the precautions in mind that we've discussed before. Get the flu shot. It's not too late. It takes about 7 days to kick in. So, as we head into Christmas and New Year's, now is the time to roll up your sleeves, get that shot. It's not a bad idea to wear a mask, especially in a crowded situation. If you're, using public transport, if you're in an airport, crowded bus, train station, use those masks. And then when you're at a family gathering, of course, we're not going to be using masks there because we're eating all of that. But, crack a window open, have some ventilation, get an air purifier. It's a little bit of dollars, but hopefully, these are steps that you can take in order to prevent sickness. And if you are sick, then please get tested because there are antiviral treatment modalities available for both flu and COVID-19. The caveat here is it needs to be started quick. So 48 to 72 hour window,
yeah.
That's why it's important to get tested.
Yes, so just go ahead and see the doctor instead of maybe just taking over the counter drugs at that point. Okay, and we have one more topic. A new study sheds light on how long COVID is affecting some folks. Tell us more about that.
Yeah, this is an interesting study. So there are about 15 million Americans that suffer from a condition known as long COVID. It's not clearly understood what the mechanism is, why some people develop symptoms that persist symphony for months and sometimes even years. It could be brain fog, exercise intolerance, a whole bunch of things that just linger, shortness of breath. So this is an interesting study. About 140 participants with long COVID symptoms were tested. Different inflammatory markers were looked at and were compared to people who either didn't didn't have COVID-19 infection, had an acute infection, or infection that had resolved. And in patients who had long COVID, there's been a steady activation of the inflammatory response syndrome. So they have chronic inflammation, signs of chronic inflammation, which may be a marker of exactly what's happening and why these folks have these symptoms. So it's promising. More research is needed, but it could point towards possible treatment modalities in the future.
All right. Thank you so much for joining us, Doc,
Sure.
and we'll see you next week.
Absolutely.
And